Hello everyone, this is Dr. Ananya. Welcome to my channel. In today's video, we'll be talking about Doppler color ultrasound in pregnancy. Before beginning the video, I'd like you to subscribe to my channel so that I can share all the valuable and useful information with you. First of all, let us know what is this test. Doppler sonography or ultrasound is a technique that uses sound waves to create an image. It is used to measure movements such as blood flow and heartbeat. It can also be used to determine the speed and direction of the blood vessels. It can be helpful in determining the fetal growth and also ensuring that the nutrients and oxygen is reaching properly to the fetus. Doppler scans are performed with the same apparatus as the regular scans. It is usually done in the third trimester of the pregnancy. This test uses high-frequency sound waves known as ultrasounds to create the image. These sound waves are not audible to human ears. Here comes a question. Is it safe to have Doppler scans? Yes. Like other ultrasounds, this is also safe. But make sure this is done by a trained professional. Most of these scans do not exceed 30 minutes and can be done within a few minutes. These scans are totally safe for the fetus as well as the mother. In the past decades, no evidences are found that suggest that these scans are harmful. Now, let us see why these scans are performed during pregnancy. A Doppler scan is recommended in the following conditions. Number 1, if the mother is carrying twins or more. Number 2, if the mother has high or low BMI. Number 3, if the mother has conditions such as diabetes or high blood pressure. Number 4, if the fetus is affected by rhesus antibodies. Number 5, if the baby's growth rate is low. Number 6, if there is a previous history of miscarriages or low birth weight. And the last one, if the mother smokes. If any of these conditions are found, Doppler ultrasound is recommended. Now let us see when your doctor will ask for a Doppler test. A Doppler scan is ordered by a doctor if there are some complications or abnormalities detected in earlier scans. This is mostly done for women who require extra care during their pregnancies. Now let us see which areas are detected in a Doppler scan. Usually, a Doppler scan is done to detect the blood flow. But if any abnormalities or complications are found in the previous scans, this has to be done in a specific way. Number 1 is uterine artery Doppler scan. Uterine arteries are the arteries that carry blood from mother to the womb. It is used to detect conditions such as preeclampsia. Number 2 is umbilical artery Doppler scan. This is done in a condition where a woman is carrying twins or more than 2 babies, or if there is a slow growth rate or there is complication of rhesus antibodies. It can be used to check the blood flow in the baby's brain and aorta. Number 3 is MCA Doppler scan, that is middle cerebral artery scan. This is used to detect and measure the amount of blood that is being supplied to baby's brain. This test is only done if the baby is suspected to be anemic, have a risk of slapped cheek syndrome, and have complications of rhesus antibodies. And number 4 is ductus venosus scan. This scan, unlike other Doppler scans, is done in the first trimester. It looks for chromosomal abnormalities. It is also used to detect umbilical vein that carries blood to the baby's heart. There are 3 types of Doppler scan in pregnancy phase. These are continuous wave Doppler, duplex Doppler, and color Doppler. So, how can we prepare for this scan? There are no preparations needed for this scan, but make sure it has to be done on the time or the schedule given by the doctor, and make sure you do not skip any of the dates. If you are a woman who smokes, then it is recommended to stop smoking 24 hours before this test. There are almost no risks to this test, as this test uses sound waves. Also, there are multiple number of tests and scans that have to be performed during pregnancy. These tests may depend from time to time. So, it's important for you to follow all the schedule of the tests given by a doctor. Along with this, it's equally important for you to get tested from a reputed and reliable lab. A link to a reputed and reliable lab will be provided in the description below. If you have any questions or any suggestions, feel free to comment down below. Till then, stay safe and stay healthy.